Hello guys, welcome to my YouTube channel. My name is Dr. Achievement, and today I'm taking you on planes versus axis in biomechanics. So let's start with plane first. I'll tell you what plane is and I'll tell you what axis is. Um planes we have different kinds of planes. All right, we have sagittal planes, we have coronal planes, and we have transverse planes. Starting with the sagittal plane, also known as longitudinal plane, is perpendicular to the ground and divides the body into left and right. The mid-sagittal plane or median plane is in the median line. It would pass through the midline structures, navel or spine, and all other sagittal planes, also referred as parasagittal plane, uh, are parallel to its most sports and exercise movements that are also two-dimensional, such as running, long jumping, take place in this plane. All right. So if coronal plane or frontal plane is perpendicular to the ground and divides the body into dorsal and ventral. Dorsal posterior or back, and ventral anterior or front portions. Now the transverse plane, also known as axial plane or cross section, divides the body into cranial, the head, and caudal, tail portions. It is parallel to the ground, which separates the superior from the inferior, or put another way, the head from the feet. Now you can see in these pictures here, this is the sagittal plane. How does it function? Sagittal plane divide the body from the midline. You can see this is the midline right here. All right, sagittal plane divide the body from the midline like this. Right part of the body and the left part of the body. Whereas, okay, this picture will show nicely. Let's say the spine runs like this. All right. So now the spine is like a form of sagittal instrument. Let me say dividing the body, right side and the left side. All right. But here the frontal plane. The frontal plane now is dividing the body. Let's say see the body, then you divide from here. You have the back side and you have the front side. Like in such a way, you can see my explanation here. Let me use some instrument as an explanation. All right. In such a way, this is here. All right. You are dividing from the midline. You're dividing from the middle of it, and we have two portions, the right portion and the left portion. All right. Whereas the coronal plane, this is the front side of it, it's watching this way. All right. Then you're dividing from this side, the middle. All right. Then you're having the back side and you're having the front side. That is for the coronal. Whereas for the vertical is actually, let's say this object is still here and you're dividing here. You're dividing from the center up and downward. That is just the difference. Now going to axis, you can see the axis showing there, the frontal axis, sagittal axis, and coronal axis. Before I explain further, before I go further, let me explain this axis. All right, the axis basically means like there is a pin, imaginary pin, um piercing the area. Now, taking the example back again, this is the object. All right. Now, let me say this object wants to perform the adduction and abduction. All right. Now, there's imaginary pin which it can't pierce here, because if you pierce here, the movement will not be able to be done. Whereas this imaginary pin will be piercing from the posterior side to the anterior side, leaving it. I can hold the imaginary item like this, and still yet I can perform the adduction and abduction, but I can't pierce from the front side in the line where it's going. So now this imaginary pin is being pierced from posterior to anterior. This means the abduction of the arm, the adduction of the arm and abduction of the arm, it runs in the sagittal axis. You can see here the sagittal axis. It's piercing from the back. It's just like a line piercing from here to here, right? It's holding the object. So if this individual have to abduct and abduct, then this line is piercing the shoulder head, the head of the shoulder, the head of the humerus. All right. Now coming to the frontal axis. The frontal axis. Now we have spoken about the abduction. Now coming to the frontal axis. The frontal axis from the frontal plane. All right. The frontal plane. You are actually piercing this like this. This is the frontal plane. It's saying you're piercing from the left side to the right side. All right. Any way you pierce is still the frontal axis, and this frontal axis perform a particular movement which is called the flexion and the extension. So if this person is performing the flexion and extension in the sagittal plane, then the axis which this movement is running through is from the frontal axis. Whereas coming to the vertical axis, it performs a particular movement which is called the rotation. All right. Now, if this person right here is making some movement of the rotation of the shoulder bone, how do you think the vertical axis is piercing? It will be piercing the head because this you can't pierce here because it's turning around. Let me say this is my shoulder joint. All right. I'm moving like this and I'm moving like this. All right. Or you can't see me clear because of the camera. All right, I'm moving outward and I'm moving inward. All right, a kind of rotation. So you can't pierce, you have to pierce from superior. That is where the vertical axis come in play. It pierce superiorly. All right, moving, let me explain. Axis is a straight line around an object which rotates. Is a straight line around which an object rotates. Movement at the joint take place in a plane about an axis. There are three axes of rotation. So now sagittal axis passes horizontally from the posterior to the anterior. Is formed by the intersection of sagittal and transverse plane. All right. Frontal axis passes horizontally from the left to right and is formed by the intersection. Intersection means is saying that there's a piercing, like intersection, from the frontal and the transverse plane, whereas the vertical axis passes vertically from inferior to superior, all right, and is formed by the intersection of the sagittal and frontal plane. All right. So extension and flexion axis, I've already explained that it occurs when an angle between two adjacent segments in the body increases as the ventral surface of the segment move away from each other and occurs in a sagittal. It occurs in a sagittal plane, which I've already explained, about a frontal axis, which I've already explained. Sagittal plane is the plane from like a division in my body, left, right, all right. Sagittal plane, if sagittal plane flexion is occurring, extension is occurring like this, then what is holding this structure together is a piercing here at the frontal axis or the coronal axis, which is running this way, is running inward. That means in that case, I'm holding my shoulder up. If I'm flexing to this direction, all right. If I'm flexing, something is piercing here. It's just like we have seen the carpenter man who is nailing to the wall. All right, like you're piercing here so that you can allow this to have that movement of flexion, extension. All right, there's no rocket science in this, but it's so confusing. That is why I'm taking my time to explain. And coming to here, okay, thank God we have a picture like this. Then here is the piercing. Here actually is the piercing for extension and flexion, these points, and we call this the frontal axis because it's running this way. Because if you're hitting a nail here, you're hitting it inward to the frontal. You're not going to the neck, sorry. You're going to actually, let me take a pen. If you're hitting the nail, you're hitting a nail in this area. All right. The nail is going this area inward, the corona aspect, whereas this is running in the sagittal plane, which is going superior, and this is going inferior, front to back. All right. Now coming to the next, abduction. All right. These are movements in the frontal plane about the sagittal axis. All right. It moves in the frontal plane about the sagittal axis, involves the body parts away or towards an imaginary line. Adduction is taking the body part away from the central line, and abduction is moving it towards. Adduction can also be moving the body part across the central line and to the other side of the body. Example, adduction and adduction at the shoulder joints and hip and fingers. Right. Now you can see this adduction. So this adduction right here is going upward and downward. Abduction, adduction. Then now here should be my piercing. I can't pierce here because if I'm piercing here, this movement can partially occur, the adduction can partially occur, but the abduction cannot occur. So I have to pierce here. You can see in the hip, adduction. I have to pierce here. All right. So adduction is piercing in the sagittal plane, whereas flexion extension is piercing. The axis is the coronal or frontal plane. Rotation. Movements are in the transverse plane and include any twisting motion. Joints which permits rotation include the shoulder and the hip. These are both ball and socket joints. We can also rotate our neck and back due to a series of smaller joints, including the atlanto-axial joint, due to which is a pivot joint in the neck between the first two vertebrae. Rotation of the hip and shoulder can be broken down into internal or external rotation, also sometimes known as medial and lateral rotation. So, for example, I've already explained we are rotating. Let me get a picture. Now you can see this here. Let's use the shoulder joint for example. Rotation is occurring. Let's say this is going this way. You can see this line going this way. Lateral rotation, and this coming inward, medial rotation. If you pierce here, you're obstructing the movement. If you pierce here, you can't pierce here because you're still obstructing the movement. Whereas you can pierce from inferior to superior, or you can pierce from superior to inferior. And this rotation occurs in the transverse plane. We say transverse plane is the plane of upward, superior, and inferior. All right. So, and it occurs in the vertical axis, which is running same direction. All right. Thank you for coming online to watch this little tutorial. Have a very nice day, guys.